Hello, my name is Mais Emad Ahmed, Assistant Professor, University of Baghdad, College of Science, Department of Biology, Baghdad, Iraq. My research title influences nano zinc oxide on Staphylococcus hominis isolation from super gingivale. Staphylococcus genus gram-positive bacteria belongs to Staphylococci family in order of Bacillus, non-motile, non-spore individual cocci with the divided into more than one blank of grab-like clusters. Oral cavity healthy, considerable importance oral cavity regard in the minerals body healthy, and reflecting some of science and system disease body like nutritional deficiency like microbial infection, oral healthy complication that not only refer to the general healthy condition. Dental caries is the most common multiplication congenital disease world wide with the previously depended on reagents, environment, many other factors. Infection disease microbiology dental caries teeth multiplication by localized tooth contact inorganic by destruction of the organic contact with the process from cavity. Nanomaterial is the field emergence and many material nanoscale with the use in the biomedical application, prevalence of virus disease, multiplication material range from 1 to 100 nanometer. Exhibit the addition zinc oxide nanoparticle attractive function with the ultraviolet and visible light resistance antimicrobial. Nanomaterial and nano technology is the emergence fields many nanoscale materials and application with the medicals and development with the novel drug, the physical and chemical method for formation of nanoparticles, morphology compounds, nanoparticles change with the formation protein and ions present in the culture medium. Aim of study biosynthesis zinc oxide nanoparticle using bacterial Staphylococcus hominis synthesis optimize condition. Determine the spectrum activity and characterize inhibition activity in vitro against gram-positive bacteria isolation from dental caries patient. Materials and methods. Isolation and identification. The first step, isolation bacteria from dental caries and using different type of media, selective media and differential media such as mannitol, salt agar, milk agar and blood agar. Confirmation identification using Vitic2 system, and finally identification by PCR technique. Biosynthesis zinc oxide nanoparticle in the figure show the principal step for biosynthesis after preparation of bacteria in the broth and filtration and using the suspension of bacteria. After that, preparation of zinc salt with the concentration of 0.01 millimeters micrometers. Addition 7 part bacterial filtration to part of zinc oxide salt. After that, incubation 1 day at room temperature. The change of the color of a tube after incubation change the color from to yellow or to brown. The first detection of synthesis zinc oxide nanoparticles. The second steps or optimization zinc oxide nanoparticle biosynthesis. Different parameter can you use to detection of synthesis zinc oxide nanoparticle, cell filtration, dilution and temperature. The characterization include UV and ultraviolet spectra analysis, AFM atoms force microscope, XRD transmission electron microscope and field electron scanning microscope. The minimum inhibition concentration after synthesis zinc oxide can you determined and preparation, concentration, MIC of antimicrobial activity, zinc oxide, the concentration between 1 to 8 microgram per ml. The results and discussion. In the figure, can you show isolation of bacteria from dental caries in the mannitol salt agar and in the milk agar and beta hemolysis on the blood agars? The first step of identification. The final step for confirmation identification using PCR technique. Biosynthesis of zinc oxide nanoparticles and the difference concentration after preparation in the powder form. Characterization of zinc oxide nanoparticles include UV spectroanalysis. Can you show in the figures biosynthesis in the UV particles nanoparticle between 200 to 400 nanometer? Can you show in the figures the peak for examination? Number 2, for characterization zinc oxide atoms first microscope AFM. Can you detection 3D FM and 2D FM? Can you concentrate size for formation zinc oxide? Transmission electron microscope under microscopic. Can you the formation and crystal formation and the size formation of nanoparticles? The last formation of characterization zinc oxide using the scanning electron microscope and field electron microscope, the range size 1978 nanometers. XRD, this examination for characterization nanoparticle, very important to detection the purity of zinc oxide using in the synthesis. In the end, can you show the zinc oxide nanoparticle assay by using well diffusion assay using against Staphylococcus hominis sensitivity word, and the result record in the figures show using difference concentration microgram per mol and inhibition zone. Can you show very clear? Can in the results, in the conclusion, the zinc oxide nanoparticle preparation from bacteria isolation from dental caries, very important and activity against some microorganism identification and isolation from dental caries. Thank you.